easy to tell people what they have. The why is where we really get into the root cause. And in the area of cardiovascular medicine, I think what you're really looking at is inflammation. Inflammation is often at the root of causing the blood vessel to do bad things, like vasoconstrict, get smaller, and raise your blood pressure. It's really, as we've looked at it, a correct but exaggerated response the body's having to a perceived threat to try to protect itself. Those threats can be things like high blood sugar, bad food, inflammatory fast foods, stress, infections. And blood pressure responds when we take some of those things away. Plaque burdens, when we look at arteries, can resolve when we take some of those things away through addressing lifestyle. We look at the genetics, we look at the advanced lipid particles, we look at the inflammation in the actual vessel, because we know these things give us added information beyond just the blood pressure, beyond just a typical LDL or triglyceride or HDL cholesterol, which most of us are getting with traditional care. So it's looking at the why and adding that to inform the what in the diagnoses. And that's really what brings the power to the causes, which are multiple, of the inflammation that's existing in the body. Inflammation is a good thing when you've got a cut and you want it to heal and go away, or a bone that you've broken. We need it to live. But it's when it's unbridled, when it goes on unchecked, that we see it behind insidiously orchestrating things like rheumatoid arthritis, which ironically doubles your risk of a heart attack, cardiovascular disease, high blood pressure, high cholesterol. Cholesterol being a response often to an immune problem. And that's the fun part of what we get to do here at Functional Medicine Idaho.